know about maternal deaths in Utah is really informed by a report that came out from the Utah Department of Health and Human Services just this past spring. And from that report, we learned that the most common contributing factors to maternal deaths are mental health conditions, substance use disorder, and obesity. So when we look at those risk factors within Utah, we find that there's a higher prevalence of risk factors associated with maternal deaths, as well as poor maternal health outcomes among women living in Utah's rural communities, as well as Utah's racial and ethnic minority women.
Mental health is such a big concern right now for everyone. We're especially worried about moms and babies because that's such a sensitive period of time, and because of the rates of postpartum depression are pretty high in Utah.
We have the sixth highest share of women of reproductive age with a diagnosis of depression when compared to all other states. And then we have the fourth highest share of women reporting symptoms of postpartum depression. In our report, we look at the rate of Utah women reporting poor mental health over a 10-year period. So from 2012 to 2022. And we find that over that 10-year period, the share of women reporting poor mental health has increased by nearly 20 percentage points to over 40%, so just under half. So having access to mental health care and having a system that actively screens for poor mental health, we know is really important.
We have both a very high need for mental health care for all of our citizens, but particularly women who are having babies. That's always a sensitive population. And alongside the high need, we have a limited number of healthcare providers. So we have fewer mental health care providers than in the nation as a whole. Some work that we're doing to try to bring more providers into the community. This is a statewide effort. It's not just us in our office, but in our office, we're working hard to incentivize mental health providers to work in rural and underserved communities. And we have loan repayment programs, and it's called the Healthcare Workforce Financial Assistance Program.
The other thing that is gaining traction are these behavioral health crisis centers. Our goal is to try to get more of them built and created in rural Utah, but the challenge with those is really finding the funding. The more of these centers that are created, we can gather better data, track outcomes, and then be able to present that to the state and say, look, these really work. They divert people from the emergency room, so it's lowering the cost of care and providing better quality.